Our next speaker is Curtis Barnett, the President and CEO of Arkansas Blue Cross and Blue Shield, a mission-driven nonprofit insurance company and the largest health insurer in the state with more than 2 million members. In Arkansas, Curtis has led his organization toward value-based care in the Medicaid program, which has served as a model for other states and for CMS, and I'm sure many of you are already familiar with that. But Curtis is also a champion of improving the health of all the people in his states by looking at those upstream factors that Don so clearly laid out. A key part of his vision for the future of healthcare is to better address the social determinants of health, including access to nutritious food, stable housing, and reliable transportation. Curtis, you'll see, is a passionate leader about these issues, and we're very pleased to welcome him here today.
Thank you, Nancy, and thank you, Don, for that wonderful, well, he's gone, but Don, for that wonderful lead-in in the back there. But thank you, Don, for that wonderful lead-in. Warren, Arkansas. Town of about 6,500 people, southern part of our state, sits in the middle of pine tree country. Lumber and logging are its biggest industries, and it's also the tomato capital of our state. Waldron, Arkansas. Town of about 3,600 people, far western part of the state, near Oklahoma, sits in the midst of the Ouachita Mountains, beautiful area, a lot of outdoor activities, wonderful bluegrass festivals they host each year. Blytheville, Arkansas, northeast part of the state, sits in the middle of the Delta, rich farming country, and more recently has become a major manufacturer of steel. These towns are different sizes, they're different geographies, different industries, but they have many things in common. They have great, hardworking people. They have strong, civic-minded leaders who want better for their communities. And they have one other thing in common, unfortunately. They have too many hungry people in those communities. And not only do they share that among themselves, they share that with Little Rock in the central part of the state, and Bentonville and what's considered the prosperous part of northwest Arkansas as well. In fact, Arkansas leads the nation, unfortunately, in food insecurity. And when I say food insecurity, really what I mean is too many people don't know where or when their next meal will come from. In our state, we have about 17% of the population who are classified as food insecure. That's about 500,000 people. We have one county in the Delta where it's over 30% of the people are classified as food insecure. We have many rural areas and inner city parts that don't have grocery stores, they don't have food pantries, they don't have a food bank there, and so they're food deserts. And while we've seen positive progress in these recent years, going from 20% to 17%, a booming economy doesn't erase the fact that many working families are struggling to provide and access good, affordable, healthy food. Now, Don did a great job of outlining, really, for us, what's going on with social determinants of health and the resilience of communities. And for us, we've really begun talking about the social determinants of health really in the last 5 or 6 years. We didn't use that term much prior to that. But our commitment to keeping people healthy goes back way before then. We formed the Blue and You Foundation for a Healthier Arkansas in 2001. And during that time period, we have funded more than 35 million projects, over 1,800 projects worth $35 million in grants to address health improvement needs in our state. So physical environment, to a healthy environment, nutrition, access to medical care, and to behavioral health and mental health resources. All those things have been part of that mission. The Affordable Care Act changed really our industry, forever going forward. Whereas before we were focused on a pre-enrollment basis, how do we identify and price and in some cases exclude risk, to really an industry that identifies and manages risk. And we had much greater and direct incentives than ever before to keep people healthy. The mission of the Blues. Arkansas is like Craig and many other blue plans around the country, 36 blue plans. It's in our DNA. We have hundreds of employees who devote thousands of hours each year to community health projects to improve those communities. The Blue Cross Blue Shield Association puts out a series called Keep America Healthy. And part of that is using big data to understand some of the most pressing healthcare issues of our time. And then finally, we've played a big role in the greatest public health issue of our time, which is the opioid epidemic. We've taken several measures within our plan, and three that I'm particularly proud of has been to make sure that first responders have access to naloxone so they can help someone they encounter who's in an overdose, and we've seen hundreds of lives being saved because of that. We're working with the University of Arkansas for Medical Sciences, our academic and medical center, on a teleconferencing approach so that rural providers can reach out to a team at the university and discuss pain treatment alternatives for their patients to get them off of opioids, but still give them a way to deal with their pain. And then more recently, we're very involved in how can we extend medication-assisted treatment in our state. But as we looked at priorities and said, where can we make the biggest difference on social determinants of health, nutrition and food insecurity kept coming back to the forefront. And part of it is the size of the problem that I referenced a moment ago, but then part of it also is the impact of the problem as well. People suffering from food insecurity are much more likely to suffer from anemia, asthma, depression and anxiety, cognitive and behavioral problems, and have much higher risk of being hospitalized and have an inability to fight off disease and infection and to recover from injury. The health-related cost associated with hunger and food insecurity has been conservatively estimated at $160 billion. So when we thought about the social determinants of health and our plans for the future, we knew that good health starts with good nutrition, and that's where we should focus our resources and our attention. Our work over the last several years have been addressing the need. Number one has been in the area of supporting grassroots efforts and increasing scale. So how could we help fund new programs and improve existing programs to impact more people? Second has been really around educating and directing individual members and who are maybe patients, and they need food in order to deal with their illness and to recover adequately. And then finally, feeding the hungry. How can we go into these communities and help feed the hungry, those that are most hit hard by this terrible affliction? So when it comes to supporting grassroots efforts and increasing scale, much of this has been done through funding, and much of it's through our foundation. We have a great partner in our state called the Arkansas Hunger Relief Alliance, who really serves as an administrator of many programs, but they also are a convener and advocate for hunger issues. And we've worked with them and with food banks and with local food pantries on local solutions related to this. We have funded a project that turned an old city bus into a mobile farmer's market. So it now goes on a regular basis and takes fresh food and vegetables into the poorest neighborhoods of Little Rock. We've helped fund backpack programs, especially one in the south central part of our state, which is a weekend program. So kids go home with 6 meals worth of food that they take with them. And that program has been copied by more than 160 food banks throughout the country. And today it serves over 7,000 students in 116 schools in several counties in the southern part of our state. Cooking Matters classes, which teaches groups of individuals how to shop for and how to prepare nutritious foods. And then finally, Gleaning, where volunteers, and many of them from our company, go into fields and glean the remaining vegetables from those fields. And this past year, we've gleaned more than 1 million pounds of food, which is redirected to food pantries. On a more personal level, on educating and directing, as I mentioned earlier, with the Affordable Care Act and our incentives as an industry really changing, it became much more critical that we keep people healthy. And to keep people healthy, they have to help take care of themselves. And it's hard for somebody to manage their own health if they're dealing with social issues like poverty, like poor health literacy, like housing needs, and like transportation. And so we recognized that in order to get them to help manage their own care, we had to work closely with them to address those social issues. And so in 2012, we began using social workers in a much more impactful and meaningful way than we have before. And that's now one of the fastest growing areas of our company, because we need their empathy, we need their skills and training around how to navigate what has been a complex system. So today, cases are referred to our social workers. In all those cases, they screen 100% or assess 100% of those for food insecurity, and about 25% of those come back positive. But food insecurity is seldom an isolated event. Typically, it is one of many factors that a struggling family may be dealing with. Our social workers use a tool called the Community Health Management Hub, which was created by the Blue Cross Blue Shield Institute, and really it's a geographic information tool, medical geographic information tool, where they can hover over a zip code, all zip codes in the United States, and see what local resources are available, grocery stores, food pantries, and other services, and make the necessary contacts and referrals to be able to help people out. And in Arkansas, we have community-based social workers, and so they actually go into the people's homes, those who are the neediest, and help them resolve their social issues, and certainly around food insecurity, put them in touch with the necessary resources. So we spent several years really looking at food insecurity from a high level as a promoter and as a funder, and at a very personal level through our social workers. But we felt like we hadn't done enough really at the community level in the area of food insecurity. And we realized that if you're serious about food insecurity, at some point, you've got to feed the hungry. And we made a commitment to do that. So we knew that in order to do that, it would take collaboration. We couldn't do it alone. We needed to work with people who worked in that space much more effectively than we had been. And we also recognized it would take a commitment of resources. But when we had those two things, the collaboration and the commitment, we then set in motion what we called our Fearless Food Fight for 2018. And actually the genesis of that occurred a couple of years prior to that in 2016, where we were involved really with funding or supporting or sponsoring the Hootens High School Football Classic that occurs each year. And this is an organization that is the first 4 football games of the season in Arkansas. And in our state, high school football is popular, and it's the same way in many states as well. And you use any means necessary to connect with your members and to connect with your community. So as part of that sponsorship, we said if we're going to be a part of this, we've got to do something more impactful. We've got to have a greater purpose. So we started something called our Pep Rallies with a Purpose. And so we began going into these communities with a partner called the Pack Shack, which is an organization in Northwest Arkansas. And they have the processes and the ingredients to have these meal packing parties or meal packing events where you feed the funnel and it creates these packets of food. And these good tasting, nutritional balanced food that with hot water comes out to 8 servings that can help take care of a family. And so we went into these communities and we began having these events. And they were very successful. Each one of those, we tended to pack about 30,000 meals that stayed with the local food pantries. But we noticed something. And what we noticed is that too many of these kids who were packing these meals were also eating these meals through the local food pantry. And so we sought to have a bigger impact. And so as we moved toward 2018, which was the 70th anniversary for Arkansas Blue Cross Blue Shield, we wanted to give back to a state that had done so much to help us build our company. So we said in our 70th year, we're going to pack 700,000 meals in the state of Arkansas, and we're going to do that with partners. We're going to do it with our customers, with healthcare systems, with schools, with colleges and universities, anyone who wants to be a part of this, faith-based organizations and local governments. And we set that in motion. And we thought we would spend most of our time in the Delta, and we could have. But we found that the need was overwhelming and the demand was overwhelming. So we worked in all 4 corners of our state, in all places in between. And you can see some of the numbers here, that we had 29 Fearless Food Fight events. We had over 3,500 participants. In one of these, we had over 600 college students who were there. At each of these events, we always had between 75 to 100 or more of our own employees who would go out into these communities and be a part of that. And we were able to pack more than 1.1 million meals in 2018, which surpassed our goal by nearly 500,000 that went to the local food pantries, 115 food banks and pantries in our state. And I just want to give you a sense, because we did, throughout the year of 2018, we did a video documentary that chronicled much of our work. And I want to give you a sense of one community story, and that's Waldron, Arkansas, and the impact that this had on them. So this is Waldron.
We have a tremendous need here in Waldron. We have so many that are out of work, and they need the help. We usually have about 15 to 16 families, anywhere ranging from 1 to 6 to 10 to 12 kids in a family. If the food pantry wasn't here, I don't know how the families would exist, what they'd do.
I had a man tell me yesterday he hadn't eaten in 3 days, and he has 4 children. So it's a necessity.
It's important that we stand behind our community and our children.
Well, Blue Cross has always been a very vital part of people's lives in this area and lots of others. And I think that this is wonderful what they're doing.
It means a lot for this to happen here, because 30,000 meals is going to touch so many lives.
I mean, it's just, I just can't envision, I can't see it. It's unreal. I mean, it's like a miracle.
I appreciate it so much that a Blue Cross and Blue Shield, you will not know this side of heaven what you're doing for Waldron and Scott County. You just won't know.
So that's a little about Waldron's story, but we had similar impact in all the communities that we visited. So where do we go from here? And as we've thought about it as an organization, our commitment hasn't wavered. We think we've done good work in raising awareness of this issue in our state. Through our partnerships, through our collaboration, we've been able to bring much more attention to this problem. We've seen, since we've been a part of this, really the network grow of more and more organizations and companies get involved with food insecurity and making that commitment, and we're proud that we've played a small part in that. We've developed an advocacy voice, which is part of why I'm here today, is to advocate on behalf of the people who are suffering from food insecurity. And let's continue to work with them to help them. And we want to pair that with action going forward as well. But at the end of the day, we're not a food bank and we're not a food pantry, and we recognize that. And we can't pack 1.1 million meals every year. But we do think we can pack at least 250,000 every year, because we do have special relationships with certain food pantries who need us, and we're committed to keeping that going. But where do we go from here? And we think some of the more sustainable actions that are needed and that we're going to plan to invest in, number one, is around education. And we think greater impact can be done through education, around healthy eating, around food shopping skills, and through cooking healthy. All of those things matter, and can we take those programs and scale those programs? Because research has shown that low-income mothers utilizing food preparation and budgeting skills experience food insecurity at about half the rate of mothers who lack those skills. So we think that's a very impactful way that we can continue to address this problem. You know, the decision by the federal government to allow Medicare Advantage plans to cover supplemental benefits, some for food, some transportation to grocery stores, that's a very positive movement in the right direction that we want to take advantage of. And then we're working with our healthcare economists and data scientists to improve our algorithms and analytics around how can we take consumer data and health claims data and clinical data and improve our predictive modeling in such a way that we can identify someone who is suffering from food insecurity before they have a significant event or episode rather than afterwards, so we can intervene with them in a very impactful way. But finally, I want to leave you with that our work in addressing food insecurity over the last several years has taught us many things. And the first one is that no one chooses to be hungry. And the second is that no community chooses to struggle. Health plans like ours, like Craig's, can and are playing an important role in building healthier communities. But it's not enough just to send a check or prescribe solutions from afar. We believe the best solutions occur when a health plan takes its resources, its data, its information, its technology, its people, and its funding, and it meets its members in the communities where they live, where they work, and where they play, like Warren, like Waldron, and like Blytheville, and that we work together, shoulder to shoulder, to understand and improve people's lives. That's the approach we think will be most successful. Thank you.